In today's meeting, we are going to have an overview of MRCPCH Clinical. Its stations, its time, how to manage, and the various things or the criteria on which you will be assessed. It is not very difficult exam, and it's not assesses the knowledge basically. It is an exam where you are assessed on your code of conduct, your methods, and all your scheme, how you tackle the patient, and how you respond to patients' queries, all that. Can everyone see the screen and hear me? Kindly tell me if anyone have problem.
Yes, we are audible.
Okay, thank you. First of all, we will discuss how many stations are there in the MRCPCH clinical exam. There is one history taking and management planning station. Another one is the development. In the development, there is history as well as assessment. And we also discuss about the management in this station. Then comes the clinical exam stations. Basically, clinical stations are 4 in number. These are just like our short cases. But the difference in R is the time. Here in the CPSP exam, we have 5 minutes, while in the MRCPCH exam, we have 6 minutes for the clinical stations. And then comes the 2 video stations. And another 2 stations are about communication. So in this exam, the circuit is made. In the circuit, there are 12 students. And the total marks are 82, in which the passing marks are 62, which is about 76.8%. And the passing score is 62. While if your score is below 52 or 52, then there is a condition in the RCPCH rules that you can't sit in the next diet. Like you have appeared in the my exam, but someone scored 50 or below 50, then he or she is not allowed to sit in the November or October diet exam. And the number of domains which they assess in these stations are 9. The clinical stations, which are 4 in number, are patient-based. Only patient will be there. In other stations, in the communication, history, and development, there will be role players, which will take responsibility of the patient and will communicate with you, address your, answer your questions of the history, and also role player of being in the communication station. He or she must be the parent of some kid or maybe adolescent girl or boy who wants some clarification about his disease or management or some other ethical dilemmas. So first, this is a circuit in the exam. What is here? 4 are clinical station. And then comes the development station, and then history station, and then 2 communication stations, and then video station. So in this circuit, the students are, before start of the exam, every student is given his sheet, which the student hand over to the examiner. And in this circuit, they are allotted each number of the station at the start of the exam. So each student go to his or her respective station, and then the time starts. Now the domains which are being present in the assessed in the clinical exams are information gathering, information sharing, and then comes the identification of the clinical signs, clinical reasoning, and management planning, and rapport building and communication style, verbal and listening skills. Another domain is managing concerns and agreeing next step. So first of all is the information gathering. Basically, this criteria, this domain is assessed in the development, as I have already mentioned, that in the development station we have to take the history. So here comes the information gathering. You are assessed how you gather the information, and the history and management station as well. Then comes the information sharing and accuracy of information. These are assessed in the communication station A and B, right? And then comes the physical examination, which is assessed in all 4 clinical stations. No, this someone has asked, is the circuit is visible on the screen? No, it is not. In the paper, it is not visible in the screen.
Acha.
They will give you a paper before starting of exam. Okay, and then the identification of clinical signs. These are again assessed in the clinical cases, and clinical reasoning in the clinical cases, in the development, in the history station, as well as in the video station A and B. And management and planning is also assessed in the same stations. Rapport building and communication styles are assessed in the development station, in the history, in the communication stations. Verbal and listening skills are assessed in the communication as well as history station. So everyone has to focus in these areas in specific stations. Basically, this is the mark sheet which is provided to the every examiner for each student, and initially here it is given to the examiners. They fill your roll number and your identity, and they will then mark here you based on your performance, either you meeting the criteria or you are borderline or you are below the criteria. And the same sheets are sent to RCPCH, and result is based on these sheets. These are some data about the percentage of passing candidates in the previous few years. Now come towards the first station, which is history taking and management planning. In the history station, the aim of the history is to assess that the candidate can take a focused history, can summarize main points and integrate these to come up with the diagnosis or the differential diagnosis. This is role play based, and no examination is in this station. It is not an test of ability to take a complete examples are, in the history station we have to take the focused history, not a comprehensive history. And in the history station only history is there and management planning is there, but no examination in the history station. Examples are like Marwan is a 15 months old and has not put on weight in the last few months. Please take a focused history and outline your management plan. And another example is like Fatma is a 4-year-old and has presented with 3-day history of vomiting and abdominal pain. Take a focused history of. In the history, it is basically 4 minutes outside the room where you are given the candidate cards where your task must be written. And for 4 minutes, you have to prepare for the history. Like everyone have their own style. We can make some rough layout on the sheet. Like we can presenting complaint, birth history, immunization history, allergy history. We can write the headings so that in the hurry we can't skip any point. In the next 13 minutes, which is with the role player, examiner will introduce self and the role player, and examiner will provide the introductory statement and ask the candidate to take a focused history. In the 13 minutes, when the 9 minutes are passed with the role player, there is a bell, and which is an alarm that 4 minutes are left and you have to wind up your history, have to ask important questions quickly. And at 13 minutes, then again, there will be announcement that the time is over. And for the next 39 minutes, there is a discussion with the examiner. Candidate will discuss the patient's problem with the examiner. Basically, the student will
हिला दे छोटा छोटा वो क्या है
candidate will summarize his history which he or she has taken and then discuss about the management plan and will answer the examiner's questions like what will be your most likely diagnosis or differential diagnosis list, what is the problem list of the child, what are the investigation you want to done, and what will be your management planning. The domains which are assessed in the history stations, information gathering, you have to ask the relevant questions and you have to gather all appropriate information and explore the problem. You have to ask about the mother or the father or the child that what is the main concern of your. You have to, like if there is a CP child and you have to take the history from the CP, there will be a long list of problems which might he or she may be facing. But the current visit is the main importance. You have to ask what is the main concern for today's visit. You have to explore that first. Then you have to have problem list. And then while you are discussing with the examiner, there you will be assessed for the clinical reasoning. Either you have enumerated the appropriate differentials or you have given the right diagnosis. And in the management planning, your relevant investigations and about the problems and also the ethical and safe management, like in the UK, they are social services and living disability allowances. You have to include all these in the management planning. And the next parameter on which you are assessed is the communication skills. In the start, you have to first build your rapport. You have to make them confident that they can discuss the problems carefully. And then while in this case, if you have to ask some personal questions, like if when an adolescent you have to, it is although not a culture in our setup, but in UK, every 12 to year old girl or boy, or even 9 or 10 years, they may have boyfriend or girlfriends. If an adolescent in the history station, you have to ask about that. But before asking, you have to take permission politely that I want to ask some personal questions. Is that okay with you? Like that. And the verbal list and listening communication skills. When the patient is speaking or the attender is speaking, you have to pay attention what he or she is saying. You have to address his concerns, show empathy, and where is necessary. And in the history, you will not have to use any jargon. Medical language is not allowed in the history station with the role player. Like you have to ask about, like we often describe as increase the frequency of urination. In urination is basically not a normal language, general population language word. We have to ask like about increased frequency of pee, or if there is, you want to know about the bowel habits, is there increase or decrease frequency of poo, like that. You don't have to use jargons or medical terminologies. If you in some point when you have to use, it is necessary to use, then you should explain that medical terminology in simple language to the attendant. Now, what are the challenges which we face in the history taking station? Basically, it's 30 minutes station. In the 13-minute station, if the problem list is wrong, you might run out of time, and the important component of the history like birth, developments, immunization history, all they may remain behind. So you should manage your history in the way that when there is a bell on the 9th minute, you should wind up that problems, and you have to switch to the these remaining component of the history. And then missed associated issues, you should not, like socioeconomic, psychosocial. In the UK, ethics, safeguarding, these are very, very, very important. You have to cover in each history these points. And at the end, you have to provide the concise and coherent summary in which you will tell like what is the presenting complaint or the list of the problem the child has. If he or she is already diagnosed, then you have to tell that he or she is diagnosed at this age and now presented with this. And then when if he is diagnosed, you have to tell about the when he is diagnosed. But the whole cycle you have not to be told in the summary, as there is only 9 minutes for discussion. So you have to wind up your summary in 90 to 120 seconds, round about 2 minutes. You have to summarize, wind up your some history summary. Sometime the other difficulty which we face in the history station, the role player will go on. If you ask some question, he or she might go on speaking about that topic excessively. She goes to the past, like this happened before, and this, and we have this. So in this scenario, you have to be very careful, and as it is not appropriate to stop directly to the role player, that it will impact a negative marking, as that you are not listening properly. The other thing which we have to do, we have not to ask compound questions or irrelevant questions. Anyone have any question regarding the history station? Can raise hand.
Ma'am, I have a question.
Yeah, sure.
Ma'am, as you said that in the UK center, you asked about the personal history in adolescents. But if you are giving exam in the Pakistan center, would this remain the same? Like if
Yeah,
you
yeah,
start
yeah, yeah,
asking a
yeah,
Pakistani child these
yeah, yeah.
questions, it will be
No,
awkward for them.
it becomes as there is no patient in the history station, there is only the role player. So you are supposed to be follow their pattern, right? If there is actual patient, this might be a different scenario. But now there is no patient, but there is role player. So someone asked the
Right.
total
So,
time. Yeah. Okay, someone asked about the time. So it is total 13 minutes in which you have to take the history, and 9 minutes in which you have to summarize and discuss about the history. It's not 30 minutes. It's 13 minutes for history taking. Next is the development station. It is the one station, and it is also of 22 minutes. The aim of development station is to assess the candidate's ability to take a focused development history. How the candidate undertake an assessment around the key areas of development. This is also a role player based exam. There is no patient in the station, and the scenario will be based on a child with an established diagnosis usually. But sometimes there might not be established, they will not tell you a diagnosis, but you have to assess in the history what might be the cause of the developmental delay, or in each case. Candidates will be presented with a scenario about a patient whose development difficulties could be in any of these areas like gross motor, fine motor, speech, social and communication. In the gross motor, we have to assess the posture and movements related questions, and in the fine motor, vision and manipulation. The fine motor, which we read in the our books, they are, and alongside this, we have to also ask for the vision. Speech and language, we assess first hearing and speech. Now, for the if we are want to assess for hearing and speech, we have to interact with the child. Like we will pretend that we will call the patient from behind so that he can respond. And if we suppose that he might have hearing problem, so when you speak in front of the child or the examiner role player, you have to cover your lips so that he or the kid may not lip read your talk, which may he or she understand. So different scenarios will be there, and you have to tackle these. In the station, the students, the candidate's age, patient age will be always less than 5 years, and usually one domain is asked for the assessment, but there might be two domains as well. Like they will ask you for the gross motor assessment, so you have to assess these, but they might say uh, find out the motor developmental age. So you have to assess both gross and fine motor. In the assessment part, you have plenty of time, and you can easily do your task. Even in my scenario, I completed my station 3 minutes before the time, and then I have a chit chat with the examiner as well about the UK situation and that. There is a plenty of time. There is no such big problem that you can't cover. Although the time for the history of the development is short. There are some examples. Like Joy is a 4-year-old born at 25 week of gestation and has cerebral palsy. Please take a relevant development history. Now, in the history, we have to take the history regarding the cause, antenatal, natal, postnatal, and any problems in the family, all their things. And next component of the task is evaluation of the NOHA's fine motor skills. Then it is fine motor skills assessment task. You have not to discuss the fine motor part in the history of the development station. While you are taking, while you are taking history for the development station, you will not touch any of the milestone from the fine motor. You have to ask the questions of other areas, but you will not ask any question in the history about the fine motor. Another example, speech development, take a relevant history, speech and social communication. Like this, in this, they have compound the two commands, speech as well as social. So you have to assess both of these, but don't ask any question regarding speech and social communication in the history part of the development station. Then the domains, time, 4 hours the preparatory time before you enter the room. You have you have to make the card, your cue card, like I will ask this domain and headings, and then enter the room. At the 9 minutes, as compared to the history session, we will have 13 minutes for the history. Here we have only 9 minutes for the history. At the 6 minutes, there will be a bell that 3 minutes are left. Then after 9 minutes, there will be again an alarm that your time is over. Now for the next 1 minute, you have to, examiner will ask to briefly summarize your finding. Then you have to summarize, and then examiner will again remind you your task that assess this domain of this child. So in the 9 minutes, you have to assess the specific domain which they have asked, and after assessment you have to summarize briefly the development milestone the child has achieved and the age according to them. Then the discussion part for the last 3 minutes, examiner will ask about the differential diagnosis, ask about the complication or investigation and management planning, and all that. So in the history, as previously I have mentioned in the history station, that in this case of development station, history you will be assessed on the information gathering, and but here other things which come as the physical examination points. As although there is no patient, but there is a you have to ask about the examiner about, like, if you want to know about the dysmorphism, you have to ask from the examiner, is there any non-peculiar facial features? The examiner will tell you no, there is no such case. Or is there any, like if there is CP, for example, you have assessed in the history, you or diagnosis is a CP, so you want to know, is there any particular body movements, or is there any device around for if they use Down syndrome, if there is, like you can ask, is the child is wearing any hearing aid, like that. You have to ask everything about the patient from the examiner, he will tell you. Then the clinical reasoning at the last 3 months, when we are discussing the management differentials and investigation, and communication skills and rapport building will also be assessed during the history taking part of the development. Now this is the development kit which will be present on your station from the RCPCH school. It may include the wooden cubes, 8 in number. Laces will be provided, toy cups, saucers, teaspoons, and insert board with shapes, and animal toy which will help in our expressive or language. The total time for the development station is 22 minutes, in which 9 minutes are for history, and rest of the time is for assessment and discussion. there will be crayons, brushes, dolls, safety scissors, and picture book, etc. It is not necessary that you use all of these, but you have to pretend that like if you want to 3-year age fine motor are your tasks, you can take the scissor and can ask, oh, the child can use scissors. He may, or she may say, examiner will respond, yes, he can, or he can't. So yes, Ifra.
But if I wanted to ask that there is no child, so how are you going to use all of these things? Like,
Yeah,
will we
we
be
have.
holding them and telling them, like,
Yeah. It's totally, you have to pretend. Like from the kit, you will pick up the crayons and paper if there is fine motor assessment task, and you will ask the examiner, okay, you have to suppose that the examiner is a child and you are doing the assessment of their child. So you will pick up the crayons and paper. You will say, okay, uh, John, can you please draw this for me? Can you please, if some examiner take the sheet and they draw, and sometimes they do that, yeah, the child can draw a circle, yeah, the child can, like this. If they are not taking the sheets,
right,
then you just have to say that I want to pick up this from the toolkit, and like to says the child can build a tower of how many cubes. The examiner will simply tell you that he or she can build a tower of 6, right?
right. Thank you.
Now this is the development milestone table. Gross motor, fine motor, speech and language, and social. If anyone wants, he or she can message me in the group. I will share there. This is again the milestone chart for hearing, speech, and language. A very good, actually, chart. It will teach us the receptive as well as expressive language assessment of the child. Okay, what are the challenges in the development station? The one main thing is I mentioned that it is very difficult to conclude the whole history in the 9 minutes, and like we have to establish the cause, so many causes of the developmental delay. We have to ask all one by one, and then we have to ask about the domains which we are not assessing. Like if we are assessing the fine motor, other domains we have to ask in the history. So it becomes very difficult to manage all these things in the 9 minutes. So there is only one solution for this. You have to practice. And the other thing, we usually don't do the development assessment in our setups as systemically as we have to perform in the exam. So somehow we manage our history station, but we are stuck here as we don't routinely perform the development assessments of the child in so detail. So the only solution is to practice. So if the child is under 1 year, like his developmental age is below 3 months, so it becomes very difficult to memorize and ask all these, because you have to ask all he or she can turn, he or she can lift his head, how much degree with straight back, with straight arms. So it becomes difficult somehow below 1 year development assessment. Any question regarding the development station? If anyone has, can raise hand or can ask me in the chat. Okay. So the next question stations. Next stations are short clinical stations. These are 4 in number and 9 minutes each. Okay. In these stations, there will be a patient. These are patient based. Outside the room, you have some time to compose yourself. Sometimes you may know about which system you are going to be examined inside the room. Sometimes you don't may not have any information. You will be provided the statement in the room, and here the candidate is assessed how competent in the clinical examination technique the candidate is. His ability to elicit and interpret the clinical signs and ability to discuss their significance. And here there is no role play, patient based. So in this station, you have to be very careful. You have to take care of every ethical issue of the examination. Like once you have asked the permission, it is not like that you are going throughout your rest of examination but not describing the patient that I'm going to do this, I'm going. It's very good. You will be communicating with the child. Tell the child, okay, Sarah, I am going to examine your pulse like this. Okay, I'm okay. When you are going to check the reflexes, you first elicit that thing on your body part, like your hand. You strike hammer and show the child that like this. I am going to check this. It will not hurt you. If there is some pain, you can tell me. But I will try that you may not feel pain. So you have to be all in during the whole 6 minutes. You have to communicate with the child, and you have to explain the steps to the child if he or she can understand. Very gentle in this station. They will assess you all things, and you have your methods should be very accurate according to the described criteria. And in these stations, you will also need to take not need to take any kit with you. All things will be provided beside the table of the patient. And the other thing, it is not necessary that if one patient is for the first candidate, the same patient will be for the second candidate. They keep on changing the patients for the candidates on the same circuit even. So at the start, the examiner will introduce and give you the statement like examples of you. Anita is a 14-year-old and has difficulty walking. Please undertake a peripheral neurological examination. So you have to focus on the peripheral neurological examination. You have first complete the task which is given to you, and like if they give you examination of the motor system of the lower limb or CNS of the lower limb, you have to examine the lower limbs alone. Along with that, when you have finished your task, then you tell the examiner that I want to examine the upper limb, I want to check the cranial nerves, motor cranial nerves. Then the examiner will say, yes, proceed. Then you have to do all this relevant. No, but at the first, you have to complete your given task. Like other examination is the Naran is 11-year-old and has a chronic kidney disease. In this case scenario, they have given you the disease. So when you are going to take the abdominal examination, after completing, you tell the examiner that I want to check for the other relevant things in the patient. Examiner will allow you. So you have to take the relevant examination points of the patient with chronic kidney disease. And if another example is Richard is a 7-year-old and has been referred by the GP after finding a murmur during examination for a chest infection. Please undertake a cardiovascular examination. Like in this system, they are giving us a command to go for a cardiovascular examination. So in this case, we will start from the hands. We look for the pallor, we look for the clubbing, we look for the peripheral stigmata of the infective endocarditis, we look for the pulses and then go upward and then come to precordium. But if the command will be precordium, you have to start from the precordium, not the pulse. There might be a patient from any system like cardiovascular, neurodisability, musculoskeletal, respiratory, abdomen, and ophthalmology, dermatology, hematology, growth and nutrition, nephro, and other syndromes as well. Or there might be a command in the station that you observe the patient and enlist your finding. If your command is this, that observe the patient, you just have to observe without touching the patient. In the whole 6 minutes, you have to just observe. What might be the dysmorphic feature the child may have, what other things. Meanwhile, you think about the syndromes like that. So in that scenario, you will not touch the patient, but you have to observe just. And one thing, as at the time of the station, when there is a syndromic child, sometimes due to exam pressure or some, as we don't have deal with syndromic patients, we might not recognize the syndrome. So don't be panic. It is not necessary that you recognize this syndrome. Just enlist the findings, dysmorphism, which you observe in the child, and then they will take you. So it is 4 minutes outside the room or the station, then 6 minutes is the time where you will performing the all examination, and then the last 3 minutes you are describing your findings and discussing the management plan and differential. So as this is the brief period of time, only the just 3 minutes. So in this station, you have to summarize your clinical findings in 1 minute, so that there will be, or below 1 minute, so that there will be a time for you to discuss about the differentials and the treatment plan, as there is marks of these criteria as well. The domains which are you are assessed in the clinical examination is the physical examination, your STEAM, your methods, and the other thing is the identification of clinical signs. And in the last 3 minutes, you will be assessed for the clinical reasoning, how you defend your differentials, and the management planning, which you will provide about that specific patient at that time. So is there any question regarding the clinical stations? If anyone has, can raise hand or drop a message. Yeah, Ifra.
Ma'am, when you told us about the station in which we have to observe the child only, in
Yeah.
which we have to list the findings that we see, will the child
Yeah.
be undressed, or we can ask the caregiver to undress them, or we're not allowed to do that?
No, you can ask. You can ask that I want a proper exposure. You can ask. In most of the
Yes, ma'am. Thank you
stations,
so
the
much.
patients are exposed to an adequate limit. But in some scenarios where the patient is not exposed to an adequate limit, you can ask. You can always
Right,
ask
thank
for such things. Yeah.
you. Right.
So coming towards our next station, which is communication. Communication, basically 2 stations, 9 minutes each. And the aim of the communication station is to test the candidate's ability, how effectively, appropriately, factually communicate with the patient or the caregivers. And also they assess you on the correct information giving in an effective manner that the child or the caregiver can understand. This is also a role player based station. No patient will be there. Role player will take the role of a parent, adolescent, patient, or an health professional, or a member of a public In this time, the examiner will be observing you for your confidence, your composed conversation, empathic approach during the consultation. It is very important to demonstrate very good listening skills, a good skill in rapport building, and respond appropriately to the scenario and to the patient's concerns and questions. Candidates will be assessed on their knowledge because in this question, not only the communication criteria will be assessed, but your medical knowledge will also be checked. Like if it is a scenario in the communication, you have to give education to some junior colleague, so your knowledge of that topic will also be assessed, but no to a wider range, but briefly how you will take that to the juniors. Where possible, you have to draw the diagram to explain it. Like if a medical student is there and understanding the cyanotic and acyanotic diseases, you can draw the 4 chambers of the heart, you can draw the aorta and the pulmonary vein, and then you can explain with the help of that diagram to the student. You will be provided paper and pencil in that station. So you are going to explain in that way. Not with the students or the juniors. You can also explain some disease to the patient or the caregiver as well. Like you are explaining the asthma. So you can draw the bronchi and the bronchioles, and you tell the patient, and there is allergen, there is narrowing of the airway. So you can tell by the diagram that this is in this way is happening in the lungs. So in the communication station, there are 6 main patterns. Any of these can be asked in the exam. One is information giving, like please tell this teenager about the diagnosis. Please tell something about like use of an equipment like EpiPen to the caregivers. Other is the breaking bad news. Like a result of an ultrasound, result of some blood test, or maybe breaking bad news of an malignancy, or at the time of the birth in the neonatal setting, they may give you the scenario about breaking the news of about biggest centennial or the Down syndrome, all these scenarios. The other type of the scenario with the communication station may have, this is the consent. Please explain why they may be reluctant patients. So you have to obtain the consent by explaining the procedure, its safety, and if the caregivers shows concerns regarding the side effects, you have to address that all, and you have to convince the patient. Like you have to explain the lumbar puncture, so you have to tell them why you need to do that, why there is a need. If this is not done, what might be the consequences, in a very polite and positive way. Don't just, if you don't go for that, your child will have a worst outcome. Not like this, you will politely go and tell them about the consequences. So in the communication, there are 4 minutes outside the room where your sheet will be provided, and you will also be give the scenario. And in the 9 minutes in the room, you will examiner will introduce, and examiner will provide the introductory statement very briefly. Detail is with your sheet, and examiner will ask to begin their session, and you will have to start the communication with the role player. Helper warns that the 3 minutes are left, and at 9 minutes, they will announce the time is over. Now, what are the challenges in the communication station? Being a Pakistani doctors, we lack empathy. We just, it is our practice. We tell the patients, yeah, this is this. We even don't listen to patients in that depth. we don't address their concerns sometimes due to our busy duty or something. So here you have to be careful. You have to show empathy. And the other thing which is inborn in Pakistani doctors is a poor listening skills. Most of the doctors, especially the training doctors, we are fed up from the hectic duties, so we don't even listen carefully. So you have to listen. If the caregivers or patient is saying something, you have to pay attention to that thing. Either it is relevant or not, but you have to listen. And time pressure to cover all the important point. As nine initially you feel that 9 minutes are too long, I will have difficulty to conversate in the 9 minutes, but when you start they goes away. It's like where I it's going so fast, so you have to manage. The one thing, if you left something, some point in the communication, it is not a big deal, but what you have done, you should have fulfilled all the components. You have showed the empathy, you have done a good rapport building, you have introduced yourself, you have taken introduction of the patient and the parent, you have listened very carefully. If you have done all things in the previous task of your communication, like you have to tell them diagnosis, treatment. If something is left, it's okay, but the task which you have full completed in the communication station, you should be very careful that all the component of the communication should be appropriately practiced. And the other thing, overlooking of emotional cues from the role player. You have to address their emotional cues as well. Like if they are crying, you have to say it's natural, okay, in these circumstances, it's a natural response. I can understand being a mother of the child. And yes, if I would be, then it is overwhelming for you. If he or she is crying, you can offer a sip of water, or you can offer a tissue, or you can ask, okay, if there is some problem, you are not feeling okay, we can have another meeting and we can discuss later. Like that, we have to address all the emotional cue in the communication station. Now, other thing is the inability to address clinical concerns or challenging situations confidently. Challenging condition might be a condition where a difficult colleague may be there, which the colleague may or may not be performing his duty appropriately, not doing his paperwork properly. So in that scenario, it becomes sometimes difficult to communicate in in this situation, to convince the colleague. These are some difficult communication scenarios. Struggling to simplify complex medical explanations for the role player. Again, in the communication station, we don't have to use any jargons, any medical terminology. If it is necessary to use medical terminology, we have to explain that in the general population language, that it means this. Okay, any questions so far regarding the communication station? Okay, let's move towards our next station, which is video station. These are also two in number, 9 minutes each. Now, the aim of the video station is to assess the candidate's ability to make clinical observation and decisions, and the ability of the candidate to identify the clinical signs which can't easily or safely assessed in other parts of the examination is examined here. Acute signs seen in the emergency department and the unit may be assessed in the video stations, as we can't have a patient in the clinical station of an emergency like croup or something like that, respiratory distress. So they include such patients in the video stations. In addition to identification of the clinical signs, candidate will be expected to discuss the questions around the clinical reasoning and initial management. So you have to identify the sign, you have to give the diagnosis, you have to list the investigations, you have to give the management planning. Video clips may or may not be accompanied by sound. If there is no need of sound, there will be no sound. And if there is a group, so there will be a sound, obviously, or like that. Each candidate will be given a brief introduction, and then the laptop will be there on the station and video will be there, and the video clips are used, and the length of the video clip is about 30 seconds to 1 minute. But you have 3 minutes. In the 3 minutes, you can see repeatedly that video clip. Like if it is 30-second video clip, you can see 5 to 6 times that clip in that 3 minutes. After the 3 minutes, a video clip will be over, and then comes the discussion point. There might be some scenario like the 4-year-old boy presented with a rash. In the video, there might be shown a rash, and if it is, they will also show that either it is blanchable or in the video clip or not blanchable with the glass. They will show you this sign. Or the other example, an 8-year-old girl presented with a wheezing. So in this video clip, they will show you, give you the sound with the video clip, along with maybe the respiratory distress sign. So as I've already mentioned that 4 minutes for preparation, you are outside the room, and 3 minutes for the video clips. In this 3 minutes, the examiner will introduce self and provide the brief statement about the clip, and then your time starts. You have to see the video clip as repeatedly as you can. At 3 minutes, there will be a bell or helper will call that the 3 minutes are over and stop watching video. After 3 minutes, then your time starts. For 3 minutes, you have to describe the findings, clinical signs, and you have to describe all the settings in which the patient was. Is there accompanying any device, or is there any oxygen, or if there is only respiratory distress, you may also mention small kid, is there any chest deformity was there or not, or other things which may point out towards an diagnosis. You have to carefully observe the whole scenario. If the child is good looking and with respiratory distress, you will mention that child is well built, but so it points towards an acute event like bronchitis, like that. You will mention all the things about the patient briefly. Then examiner will ask to formulate likely diagnosis and differentials. Again, after 3 minutes, the bell will ring and you have to discuss about the investigation list, and then the examiner will ask about the management planning. And at the end of the 9 minutes, there will be a bell which will warn you that station is over. Now, the assessment criteria in the video station are the identification of clinical signs, then the clinical reasoning and management planning in the discussion part in the last 6 minutes. In the 3 minutes, you will be assessed for the identification of signs, and then the 6 minutes, you are being assessed with clinical reasoning and management planning. Now, the resources for the clinical exam. Now, The most important book for the clinical exam is Past Test MRCPCH Clinical Short Cases, History Taking, and Communication Skills by Mark Beatty. It is very, very, very important book. And actually, and 80 to 90% of the time, the history scenarios are the same as they are provided in the book. They are around about 16 or 17 scenarios. So these scenarios should be your own fingertips in the history practice. Other scenarios can also come, but is less frequent. And the scenario given in the book are very frequent in the history taking and in the communication as well. So you have to study this book more than once. Then comes the guidelines, which help you in the video station. And as I've told you that in the video station, they will show you acute events. So you might have to make the management planning on the basis of the guidelines. And guidelines will also help you in the history, like if there is abdominal pain history, so you have to rule out all the red flags of the abdominal pain. If there is a history of headache, you have to rule out all the red flags of the headache. The other thing for the communication stations is the Rebecca. It's a very good book, and but it's quite long book. So what I did, I studied communication stations from the different books, but from the past records, which I don't find in the other notes or something like that, I consult it with the communication book of the Rebecca. Then survival guide can also help you in the clinical. As I mentioned, like in the clinical station, only 3 minutes are there where your knowledge is judged, and in the history 9 minutes. So there is very little time where your knowledge is assessed. So you have to be not so need so broad books you have to study. Just you have to study the main ideas of the topics, so you can discuss effectively the differentials and explain the clinical science. So survival guide can help. It is a very good book actually. And the one thing which also helped me a lot is the YouTube channel of the London School of Pediatrics. They have shown the clinical short cases as well as some history stations. So it is a very they are very good. And the examiner in the clinical short cases, the candidates have explained very beautifully that how you have to proceed in the examination, how you have to communicate with the patient. I have learned a lot from these videos, how to interact with the patient or how to engage the child. Very good videos. And then comes the local resources. There are various summarized books, courses available, notes available. You can study, and if you like something, you can opt for that. And the one thing for the success is the practice, practice, practice. Basically, we have the knowledge, but we have to tailor our knowledge and our skills according to the RCPCH criteria. So for that tailoring, we need to practice, practice, practice. Thank you so much. Any questions? If anyone has questions, can drop me, can open your mic, or can raise hand.
Thank you so much, ma'am, for the detailed input about all these sessions. Ma'am, can I ask you what is the total time duration of the exam?
Like in the exam, when you enter the circuit, they goes on continuously all the station. When you have covered all the station, then you come out of the circuit. So in the there are 4 clinical short cases. So there are 36 minutes for that, 9 minutes for the communication stations. They will be added up 22 minutes for the history and development, and 9 minutes for the video stations. So there are 8 stations of 9 minutes and 2 stations of 22 minutes each.
And like as you have done FCPS pediatrics, so how much time would you recommend for a person who has done FCPS pediatrics and is to appear in the clinical examination? How much
Uh,
time should be required for all of the preparation and all of the orientation for their ethics and safeguarding stuff?
okay. Okay. If the time required for the preparation depends upon the current working you are, as you have mentioned that you have done with the training. So for the people who
Done with the
have,
FCPS part exam.
okay, FCPS Part 2 exam, right?
Yeah, yeah.
Okay. Then you just need
And been practicing for last 5 years in a tertiary care hospital.
that's very really good. So just you need about 2 to 3 months, as you are already in the tertiary care, you are in touch with the clinical practice, and you have done all through. You just have to tailor your knowledge. So for that purpose, you have to renew. In the tertiary setting, you are not out of touch from the clinical, so you need only 2 to 3 months for the preparation.
Right, ma'am.
Yeah.
Thank you so much.
Yes, Dr. Nagina, there will be no break between the stations. Once you enter the station, you will be out after the end of the stations. Okay. Total time duration, ma'am, 9 minutes for 8 stations and 22 minutes for 2 stations. About 1.5 hours to 2 hours. Dr. Asim, the time required for the preparation is depend upon in which setup you have done with the training or not. It's all depend upon that. Yeah, if I'm appeared in the Pakistan, the first exam which was conducted in the Pakistan in the September 23, I appeared in that exam. In each station, there were examiners from the UK and as well as from the Pakistan. And in each station, there is only one examiner. However, in some station, there might be two examiners. But where you find two examiners, the other examiner is not actually assessing you. The other examiner might be assessing the examiner which is assessing you. Like if there is Pakistani examiner who is registered with them or have certificate with them, the UK examiner will be assessing the Pakistani examiner, either he or she is doing his work appropriately or not. Okay, thank you so much for everyone for attending the session. Yeah, in the Pakistan, we have to be communicating with the patient in Urdu, obviously for short cases. Thank you, Dr. Shapak, for the good comments. Thank you, Dr. Ifra, for joining. Thank you. Good luck, everyone, for the exam. Take care. Allah Hafiz. If anyone has question, can message me in my WhatsApp group. I will answer the queries there as well. I have shared the link of the group in my Facebook page, MRCPCH Excellence Academy. The link is there. Thank you, Dr. Varda, for coming up.